Plastic surgery can solve a lot of problems for people. It allows patients to improve their appearance, boost their self-esteem, and feel confident in their bodies. Liposuction is one of the most popular plastic surgeries for several reasons. Multiple areas can be targeted in one single surgery. It's an outpatient surgery with minimal downtime. Patients can return to work in a couple of days. Liposuction, rooted in the Greek word lipos, and the Latin Greek term suctio, stands for the surgical removal of fat using suction techniques. Without a doubt, a liposuction is a useful tool for sculpting the body and getting rid of stubborn fat, but it's not a replacement for exercise and a healthy diet. What should I ask my surgeon before deciding? Before committing to a surgeon, you need to make sure you're in good hands. You want to be sure that your surgeon is experienced and certified and has done numerous liposuction surgeries. You should also ask for before and after photos from their other liposuction patients so you can get a better idea of what your own results will be like. If they don't have photos to show, then that's a sign they may not be very experienced. How much fat can be removed during a single liposuction session? The amount of fat that can be removed during a single liposuction session depends on your anatomy, health, amount of blood loss during the procedure, and your plastic surgeon's comfort level. According to the recommendations of American Society of Plastic Surgery, only 5 L of fat can be removed during one liposuction session. Is liposuction surgery safe? Like all surgical procedures, there are some risks associated with liposuction: contour irregularities, infection, fat embolism, lidocaine toxicity. Generally speaking, however, liposuction is considered a safe procedure, and if you follow your post-op instructions closely, there are rarely any serious complications. Safety and efficacy may be why liposuction is one of the most popular plastic surgery procedures. What are the benefits of liposuction? One benefit of liposuction is that you can permanently remove fat from one area. When diet and exercise fail to eliminate unwanted fat, with a relatively quick and straightforward liposuction procedure, this fat can be removed. You are given a new body. After liposuction, you may be able to wear smaller, tighter-fitting clothes. Another benefit of liposuction is that removing fat may make exercising easier. Another possible benefit of liposuction is that it may increase your self-esteem and improve your relationships. Also, medical studies have conclusively shown that fat removal with liposuction can improve your metabolism. Additional studies have shown that liposuction can even help with diabetes control. What is the ideal body mass index, BMI, for liposuction? The ideal body mass index for liposuction is less than 30. Ideally, plastic surgeons want their patients to undergo plastic surgery when their BMI is less than 30. However, BMI is just a single number. BMI should be taken into consideration of your past medical history and weight loss history. There are exceptions to patients having liposuction with a higher BMI. Consideration to undergo liposuction with a higher BMI is determined by you and your chosen plastic surgeon. A BMI over 30 does not automatically disqualify you from liposuction. Can I use liposuction in combination with other plastic surgeries? Yes, that's very common. Liposuction only removes pockets of fat. If you have loose skin, a tummy tuck may be something you also want to consider. The two procedures are often done together to help new moms get back to their pre-baby shape or help those who have lost substantial weight perfect their looks. Should I have a tummy tuck or liposuction first, and why? If you are considering whether to have liposuction or a tummy tuck first, the decision depends on your anatomy. You will probably do best with a tummy tuck if you have significant excess abdominal skin. If you do not have stretch marks, are younger than 40 years old, and do not have loose abdominal skin, you may do best with abdominal liposuction. If you have liposuction after a tummy tuck, this will not harm your tummy tuck results. However, liposuction after a tummy tuck could cause some loose skin on top of your tummy tuck. In addition, you can have liposuction after a tummy tuck. Scar tissue left over from liposuction does not prohibit you from having a tummy tuck. Are there any age-related considerations for liposuction? No, there are no age-related considerations for liposuction. You can still undergo liposuction if you are older and have no medical contraindications. However, if you have contraindications to surgery due to pre-existing medical conditions at any age, you should not have liposuction. Therefore, elderly patients without medical can undergo liposuction, whereas younger patients with medical contraindications cannot. Can liposuction tighten loose skin? In general, traditional liposuction does not tighten loose skin. During liposuction, the supporting layer to the skin is removed, so the skin becomes loose. Typically, the skin can contract a little bit. However, the garment helps facilitate the skin sticking to the underlying tissue. Of all the types of liposuction, Vaser liposuction has the most promising results when it comes to skin tightness. Vaser liposuction helps to melt the fat, heat the skin, and maximize skin contractility. Will there be a scar? The cannula that is used in the surgery is very small, so scars should be minimal. The number of incisions is based on the target area and how much fat needs to be extracted. Some people are more prone to scarring, while others are left with no scars. If you are prone to keloids or excessive scarring, disclose this to your surgeon. Can I get liposuction twice? Yes, it is possible to get liposuction more than once. However, it is important to note that liposuction is not a weight loss method and is best suited for people who have reached a stable weight and have isolated pockets of fat that do not respond to diet and exercise. Can liposuction get rid of stretch marks? Liposuction is a body contouring procedure that is used to remove isolated pockets of fat that do not respond to diet and exercise. It is not intended to remove stretch marks. Stretch marks, also known as striae, are a common skin condition that occurs when the skin is stretched rapidly. They are often caused by pregnancy, weight gain or loss, and hormonal changes. They appear as lines or bands on the skin and are usually red or purple in color, but over time they may fade to a silvery white color. Liposuction can help to improve the shape and contour of specific areas of the body by removing excess fat, but it cannot remove or improve stretch marks. Stretch marks are caused by damage to the underlying layers of skin, not by excess fat. Can liposuction treat cellulite? Liposuction does not treat cellulite. Cellulite results from the constriction of vertical bands of scar between the dermis and the underlying fascia. This contraction causes an indentation of the skin. The best cellulite treatment is to cut these vertical bands. During liposuction, some of these vertical bands are accidentally cut. However, in general, liposuction removes fat under the skin. Fat removal with liposuction will not change the vertical scar bands. Indeed, by removing fat, liposuction can worsen cellulite in some areas. Can liposuction affect pregnancy? Liposuction is not expected to affect pregnancy or future pregnancies. Women who are considering liposuction should wait until after they have completed childbearing, as weight gain during pregnancy can cause changes to the body that may affect the results of the procedure. When can I swim after liposuction? You can swim when the incision sites have closed, and all skin port sites have stopped draining. Typically, the skin sites are closed at approximately 2 weeks after liposuction. When can I have sex after liposuction? Many patients worry about having sex too soon after a procedure. Since liposuction involves no cutting or stitches of any kind, there is no concern that you might damage anything. However, you might experience slight discomfort, bruising, or swelling after your procedure. The same factors that might keep you from exercising too rigorously may also keep you from becoming intimate too soon. The bottom line is that you should listen to your body. When it feels comfortable, the time is right. What are the do's and don'ts after liposuction? Do's. Follow your surgeon's post-operative care instructions carefully. Wear the compression garments as directed for improved blood circulation. Get plenty of rest and avoid strenuous activities for at least the first 2 weeks. Stay hydrated by drinking plenty of water and other fluids. Eat a balanced diet that's rich in nutrients to promote healing. Gently massage the treated areas to promote circulation. Attend all scheduled follow-up appointments with your surgeon to monitor your progress. Take pain medications as directed by your surgeon to manage discomfort. Gradually increase your activity level as advised by your surgeon. Stay patient and give yourself time to recover fully. Don'ts. Don't smoke or be around secondhand smoke. Don't drink alcohol or caffeine for at least 48 hours after surgery. Don't take blood-thinning medications without your surgeon's approval. Don't engage in strenuous activities or exercise until your surgeon approves. Don't remove the compression garment without your surgeon's approval. Don't submerge the treated areas in water or go swimming until your surgeon approves. Don't expose the treated areas to direct sunlight or tanning beds until your surgeon approves. Don't neglect your emotional health during the recovery process. Don't hesitate to contact your surgeon if you have any concerns or questions. Don't expect immediate results. Be patient and allow time for your body to heal and adjust. What liposuction should not treat? While liposuction has many uses, it is not meant to help people lose weight. Not a treatment for obesity. Not a fast track to a fit body. Not a treatment for cellulite.